Asphyxiation is basically the process in which the outlet, the air entry into the air lungs and the airway passages is basically blocked, and it can result into the fatalities. A lot of fatalities have occurred due to this asphyxiation process. Now, we are basically limiting our discussion over here on the fatal pressures on the neck and how they can prove to be fatal in a lot of cases. So right now, basically in this section, we are limiting our discussion to the manual strangulation, which is basically the use of the hands for putting pressures on the neck. So the use of the hands is highlighted over here. And how are we going to emphasize the fact as a forensic expert, whenever you are carrying out any investigation, what are the points of identification that are going to lead towards the manual strangulation? And that is basically going to be the mainstay over here. Now, first of all, we'll be discussing the autopsy appearances in the manual strangulation, because that is the most important thing that is basically revolving around the forensic medicine, leading with basically that is dealing with the legal states for deaths in such cases. Now, the bruising and the abrasions on the neck. So we'll be focusing on the injuries that has occurred, and most probably the injuries are usually that occur during the manual strangulations are the abrasions and the bruising phenomena. So because the hands have been used, it's not a sharp object, it can be considered as a blunt object, and pressures are put by this manual strangulation. So only bruising and some sort of abrasions will be seen on the neck, and that are going to point out towards this phenomena that the underlying mechanism behind a certain death is the manual strangulation. Now, also, there are some changes at the internal level. So the internal appearances of autopsies in cases of the manual strangulation, they have their own significance over here. And so we'll be discussing also that in this section. And that is basically going to be discussed over here. One has to keep in mind that basically there are a lot of other phenomena, for example, mugging. And mugging is also basically, it occurs between the body of a person and the bend of the elbow. So again, the bend of the elbow can be used for putting pressures on the neck. Again, we have to keep in our mind, we are only restricting ourselves to the manual strangulation where hands are used, not the bends of the elbow. So that will be a variation, but still the features will be quite similar or overlapping in these cases. Now, whenever we are discussing the autopsy appearances in manual strangulation, so there are two groups basically. The local signs of violence are quite evident over here, and the signs of the mechanism of death are again going to be very similar to any normal signs that we have already discussed. There will be congestive phases, petechial hemorrhages are going to be there, and signs of congestion, the bluish discoloration, all of these signs that I've already pointed out, they are going to be there in this manual strangulation as well. Now, the bruising on the neck is again another phenomena. Abrasions from victim or assailant, it can occur after that. There will be discoid abrasions. Now, why the bruising is discoid? Because of the thumb. So the thumb is going to basically produce the discoid bruising that we're talking about. The large areas of confluent bruising are also present if some time has elapsed from this manual strangulation and the death of the person. Basically, they cluster at the sides of the neck. That is the basic site where the neck is strangulated, and may overlap the jawline. Now, due to the shifting grip, they may change places or they may confluent together, and they're going to form a bigger bruise in such a case. On attack, fresh, dark, red or purple bruises are found if they are fresher in nature, and all of the changes of the bruise, the color changes that have already been observed, for example, green, yellow, all of these changes according to the duration of time that has elapsed, they'll be seen in such a case. Superficial hematoma formation is another feature of bruising that is seen over here. There is an asymmetrical pattern that is seen, that is quite evident whenever we are discussing this bruising phenomena concerned with the manual strangulation. It is quite a fortuitous bruising phenomena. It can move, it can confluence together. That is again going to result in that. Now, the determination of handedness is again going to be there. The size of the hand depends upon the attacker's size, the orientation of the attacker, and the intent of the attacker as well. The abrasions on the neck, they're going to be seen. As you can see in this picture, there are slight abrasions, there are slight bruising, so it is going to be a mixed pictured phenomena whenever manual strangulation comes into play. The scratches from the fingernails are again going to be there. They're going to be linear scratches, and linear scratches basically even longitudinal, they can be there. The abrasions of the epidermis is found in such a case. And there are diffuse aberrations in general whenever we are discussing these aberrations on the neck. Two types of scratches: pressure in the static, straight or curved scratches. So it can be a linear scratch as well as it can be a curved, straight, or it can be a static scratch whenever the pressure is put only on a single place. Now, the abrasions on the neck are again quite common over here, and the underlying bruises are again going to basically be highlighted by such abrasions. Static nail marks, often semilunar, are found. Female nail leave the obvious marks. Defense scratches are going to be there. They run in parallel lines from the grouped fingers. The autopsy findings in such a case are the fingernail scrapings or the clippings. They are found in such a case, and they are preserved and labeled whatever they are in number in. You have to basically count the abrasions, and you can just note them down, or even on the body and even in the autopsy report. Then skin fragments, or they're also known as the skin tags, and they're again going to be very important. Blood under nails, it's also a very common phenomena over here. Blood typing or DNA characteristics are found, and they're quite evident whenever we are considering these autopsy reports, because we have to find the assailant's blood, and it has to be matched with the victim's blood. Now, the hairs and the fibers are again going to be collected, because they are the trace evidence and that can basically clue towards the assailant. So we have to basically collect the blood samples, the hair and the fibers, whatever is found on the body, and whatever scratches or grazes are found on the body. The internal appearances in the manual strangulation are again very common, and they are to be noted. Bruises usually confined to the dermis. The platysma muscle may be bruised as well. Sternocleidomastoid and deeper strap muscles, they start bleeding because they are damaged after these fatal pressures, and that basically result in a hematomatic states. Infiltrated blood is found in the areas surrounding where the injury has occurred. So all these findings, it's basically the bleeding, the bruising, all of this will be present in cases of the manual strangulation phenomena. On internal appearances, we're also going to see release after the manual strangulation. The blood is going to be released in the venous system. There'll be a reduced artifactual hemorrhages will be seen in such cases. They're going to release the venous engorgement as well. Investigations such as a multislice spiral computed tomography is one of the important investigations over here. MRIs are done, and radiography of the neck. So all of these are the mainstays over here, just to note down the internal damage that has been occurred to the neck. Now, to determine the state of the soft tissues, these radiography images are seen, and that basically involves the neck, and the cervical spine is also involved in such cases. The x-rays of the isolated larynx are again going to be noted. The removal of the overlying tissues is done, and the internal examination is carried out in detail over here. Bruising into the thyroid capsule is also one of the phenomena that is seen, and careful handling of the vascular bundles is done just to avoid any damage at the autopsy, because even the autopsy itself can be damaging to the person whomsoever the autopsy is performed on. The carotids are opened in situ, and they are looked for any signs of congestion, and that are also be noted in the autopsy report. So in this section, basically we dealt with the manual strangulation. where the hands are used, and what are the internal appearances as well as the external appearances in such cases of manual strangulation. That is the end to this section. Thank you for watching sqadia.com.